So today we have Associate Professor Kevin Tan from the NUS Yong Lu Lin School of Medicine to speak on his topic, the importance of applied biomedicine in a post-COVID-19 pandemic world. We'll also be having a question and answer session after this talk. So those who are tuning out online, during the Q&A session, you will be able to see the function on your screen. For those who are attending here physically, there will be a QR code for you to scan to submit your questions, or you can just approach the mic stand in the middle of the room. Okay, so without further ado, please help me to welcome our speaker, Associate Professor Tan. Professor, please.
Thank you very much, Terence. Really a pleasure to be here. Nice to be out of the pandemic, be able to interact face-to-face. It's so much more engaging and enjoyable. But also welcome to our online audience. I understand there's several hundred, if not over 1,000 of you zooming in from all over the world, predominantly from China. So, 各位观众, 你们早上好. That's the only Mandarin I know. So the rest will be in English. I hope you don't mind. So I'm here to give you a master class on the importance and relevance of applied biomedicine, or the study of biomedical aspects of medicine in a post-pandemic world. Right? And why are we so concerned about this? Well, we know it's a viral disease. COVID-19 is a viral disease. But this pandemic rocked almost every aspect of our lives. Importantly, our world economy. So here you can see, once the pandemic was announced in early 2020, stock markets from all over the world, from China all the way to the US, crashed. Slowly picking up, but when did it shoot up? When the first vaccine was rolled out. So good news and bad news can affect our economies, right? But one thing was evident in the first year of the pandemic, there was a global recession. So almost the entire world went into recession. And now there's still some economies still struggling to recover from the pandemic. More directly, there were healthcare impacts. As to date, there were about 7 million lives lost out of 700 million infected individuals, so about 1% mortality. Now, 1% is a small number. If you have 100 people, 1% would die from COVID. But if you talk about 700 million people, then you're talking about 7 million deaths, which is what we have as of today. Okay, so mortality is not, the number is not relevant if you have a large-scale event. Okay, the impact can be still very significant. So about over 700 million confirmed cases as of recently when I checked, and almost 7 million deaths. So I'm missing one slide. Oh, yes, okay. So when we talk about the management of a pandemic, or we talk about how to address a pandemic, I call this the Trinity of Management, Vaccines, and Drugs, okay? And this is not new. Whenever we handle a disease, we talk about its transmission in the community. How do we address it with therapy, chemotherapy, as in drugs, and how do we prevent it with vaccines and other interventions? Okay, and so I call this management of disease, drug discovery and development, and vaccines and immunotherapy. So this trinity of approaches is crucial in managing pandemics, and because of the recent pandemic, we've learned a lot of new lessons that will prepare us for the next pandemic, all right? And these principles and concepts are applicable to all diseases. Even if you consider cancer, there's also how cancer is spread, the epidemiology of cancer. There are cancer vaccines, anti-cancer drugs, right? But there's another reason why we need to study biomedicine and study it accurately. And I'm not sure whether you're aware of this rising threat of anti-science. There are people in our community, particularly in the West, even politicians and very influential people, who do not believe in science. They are against facts. They have alternative facts, okay? And because they're influential, they can sway populations. They can sway hundreds and thousands of people to not believe in vaccines, for example. So you have the rise of anti-vaxxers. We know that, we know that the American president was talking about controversial treatments. And because of his posture, it affected STEM PhD students in the US. They could not get positions, they were discriminated against, especially the Asians, and many had to leave the US. So the posture of politicians can also impact the ground, right? We have the Brazilian president who touted that chloroquine would be good against COVID-19. There was no scientific basis for that. And then you have the rise of the sovereigns, the people who feel that there's no government should tell them what to do. If I don't want to wear a mask, it's fine. COVID doesn't exist in my world. So that's a very dangerous threat to our world as well. So that's kind of a justification for the increasing relevance of biomedicine and its education in the current global economy. So let me start with the first pillar, infectious disease management. How are infectious diseases managed with reference to some extent to the pandemic? There are three approaches to managing the spread of a disease. Okay, there is prevention, there is surveillance, and then there's control. Control also involves intervention, right? So in terms of prevention, you need to understand the disease, talk about vaccines and drugs. Surveillance, we need to understand outbreak management, epidemiology, and for control, we talk about control of diseases, but also an emerging concept called the One Health concept, which I'll elaborate on in the upcoming slides. So we are all aware that we're in a new era, the pre-pandemic, pandemic, and post-pandemic era, right? And we know that the next pandemic will happen. Every 10 years, something will emerge. It could be something we know, like Ebola or COVID-19, or it could be something we don't know, where it will just jump from the animal reservoir to humans. Okay, so we need to be prepared. We have less time than we think to prepare for the next pandemic. And one thing that we've learned is that the response is complex, but necessarily integrated. So we need to involve the community, there's government funding, healthcare, public health functions, medical technologies, bounded by collaboration, which is key. And then we have to ensure that it's equitable, that it is fair, that poorer countries are not disadvantaged because of our new technologies. So one concept that has emerged in recent years is the One Health concept. And this is the appreciation that we do not live as an island. We, in any context, interact with animals and with environment. Okay, and we know that animals can spill over to humans because we interact closely with them, but humans can also infect animals. Okay, so there are two-way interactions between humans and animals, and this is always in the context of your environment. Your environment changes, your chance of being infected also changes. So One Health is adopted by the Singapore government, adopted globally in many agencies, and for our government, we have Ministry of Health, NEA, NParks, Singapore Food Agency, and PUB. So these are all health, animal, environment agencies. So they work together to monitor, to surveil, and to prepare for the future. What are the key components of this new concept? We talk about issues, right? The One Health issues, the rise of antimicrobial resistance, rise of new infections. But what are the sort of players in this? If you look at them individually, they don't seem to have any immediate interaction or relevance. What has climate change got to do with antimicrobial resistance? We're talking about increasing temperatures. What's it got to do with AMR, right? What has environmental contamination got to do with zoonotic diseases, right? So taken separately, they are not intuitively connected. But taken together, you can see how one really impacts the other. Okay, so this is how One Health is being taught in universities nowadays. In the context of zoonotic infections, and zoonotic infections mean infections from animals to humans. That's why the word zoo means animals, right? Zoonosis is an infection from animals to humans. We find that ourselves, animals, and ecosystems are tightly interlinked. And because we are growing, we are traveling, we are eating new things, we are trying new foods, we are often in contact with either live or dead animals, right? And this increase in contact between humans and animals in certain environments increases the chance that a new disease will emerge in due course. 3/4 of all all infectious diseases are from animals. Even your flu can come from pigs, from chickens, and animals. So flu, we can transmit flu, but all these new variants, reservoirs are in animals. Okay? So that's why the One Health concept is extremely important. In fact, before COVID-19 and the One Health idea, this One Health concept was already evident when we see the rise of antimicrobial resistance. This is an issue plaguing healthcare systems worldwide, especially in hospitals. And this is due to the inappropriate use of antibiotics, not just in humans, not just your GP maybe giving you antibiotics because he doesn't know what you have, or you not compliant and you don't take the antibiotics because you don't want to finish the course. It could also be antibiotics treatment for animals to help them to grow. These can contaminate the environment, evolve, and come back to haunt us. So this is the concept of the 3 components of One Health interacting to give rise to a problem. So we have 10 million deaths by 2050 just due to the fact that antibiotics no longer work against common diseases. Did you know that in the context of COVID-19, 80% of patients that were warded for COVID-19 were also given antibiotics? And because it was such a messy, stressful environment, it was hard to monitor how these antibiotics were given, how compliant were the patients, and so on. So there was an increase of 15% antimicrobial-related deaths during the pandemic. So one viral infection can also impact a bacterial antibiotic. All right? So that's how interrelated we are. And how do they spread? How do these antibiotic-resistant bacteria spread? Through many ways. When we use inappropriate prescription antibiotics, when maybe it's not required, we can just use symptomatic treatment, but it's given anyway. This can spread, especially in healthcare facilities, in your hospitals. In the context of low hygiene standards, then you have fecal-oral spread. Then you have all these, in more rural areas, poor husbandry practices and all that can lead to spread of infection, spread of AMR. Now, the environment is also very important. Where you are in the environment can actually trigger outbreaks, and we call this urban outbreaks, right? And urban centers risk being conduits of transmission in the world. This is because there's high population setting, there's interesting habits. We like to try exotic foods, right? There's a mix of humans and live or dead animals, and encroachment into natural habitats because we are adventurous, or because we are undergoing deforestation, or we just want to try new things. So there's this important aspect of control of diseases called surveillance and prevention. And this involves many things: vector control, sentinel testing, contact tracing, and so on. So when EDB comes to check your homes for mosquitoes, this is part of surveillance. Okay? The fines that you get, probably it's not. It's just discouraging you from growing mosquitoes, right? So I'm not going to elaborate on this slide, but in terms of how we approach outbreak surveillance, there are many steps, starting from getting your community workers together, moving on to engaging your vets, your clinicians, and then developing technologies to survey. You need your dipsticks, you need your PCR tests, but more than that, you need your data managers. What does this all mean? Is there a rise in cases? Can we predict a new infection? And then it moves on to public policy. How does the government then transmit this information to the community so that they will buy in and believe that this is the right thing to do? Okay? Then how do we control these infections? Once you know it's there, it's no point just knowing, right? You need to take the next step and break the chain of infection. And this is ultimately what you want to do. And in order to break the chain of infection, you must understand how the infection progresses, right? If it's aerosol or respiratory, then you know it's the mask, right? If it's sexually transmitted, the mask will not help. It's other means of breaking the chain of transmission. So these 5 ways: stop at the source, block the portal, interrupt mode of transmission, protect portal of entry, increase host defense, is general, but applied uniformly during the pandemic, right? So I've covered the first pillar, which is infection and the control of pandemics. But what do we do in terms of prevention? And what do we do with the knowledge of immunology? How does it also reach out to cancer patients and so on? This is where we talk about the beauty and importance of immunotherapy and vaccinology. So a lot of people don't like immunology because it's so complicated, but there's a lot of beauty and elegance in how our body fights off infections, right? So we do study very basic immunology. In this case, signal transduction leading to an immune outcome. But all this leads to applications, either in infections or in cancer. And there are various cutting-edge technologies that are used today to address diseases such as infections and cancers as well. We also look at aging and microbiome as factors that influence the outcome of our immune treatments. So in response to anti-vaxxers, there are people, and even in Singapore, who don't believe that vaccines are effective or useful. If you look throughout history, mumps, Hep A, rubella, chickenpox, and if the blue circles represent cases and the orange circles represent when the vaccine was introduced, you can see that there's a dramatic decline in the number of cases after the vaccine is introduced. So this is scientific evidence that the vaccines do work. And of course, if you don't have vaccines, the numbers will persist. Lives continue to be lost. What was amazing is it takes 10 years to develop a vaccine from concept to implementation because of all the paperwork and the R&D that's required. How long did it take us to roll out our COVID vaccine? Less than a year. So from 10 years to less than a year, we now know it's possible if there's a concerted effort, if there's political will, and there's collaboration. 10 times the speed, right? And one reason was because they did rolling approvals. Before one section was completed, when they knew it would be successful, they started out with the next section. So there's this overlapping rolling approvals. But mainly, there's a lot of global support and collaboration. So we are in a new era. We are an era where we can save many more lives if we can work together. Okay, so in terms of vaccine development and modern applications, this is a very complex picture to tell you what happens in your body when you take a vaccine. When you take your nano vaccine, you take your mRNA vaccine, a lot of things happen which I don't have time to elaborate on, but ultimately it leads to a robust immune response that has memory, so that when you have the infection again, you can wipe it out very quickly. Okay, so the process is discovery, determine efficacy, improve design, and nowadays we use design with the help of AI to rapidly identify targets, and then we have to do new forms of delivery using nanoparticles, using new kinds of vectors and carriers. So I'd like to segue a little bit and move away from vaccines to this concept that not many of us may be aware of. It's called immunotherapy. Okay? It's a bit like vaccines because you're using your body to fight off an infection, but this is used mostly for cancer. Okay? And immunotherapy relies on your own system, your own cells. What we do is that we supercharge your cells, we modify your cells, your own cells, in the lab, and we put it back in you to fight off cancers. Right? And this is personalized because it's your own cells, your own cancer, and the cancer's own antigen. And this is best exemplified in a therapy called Kati. And you may have heard of Kati in the clinics. You may have read about it. And this means chimeric antigen receptor. Essentially, if you have, let's say, leukemia, okay, as more in children, right? You have a childhood leukemia, the doctor will take out your cells, isolate your immune cells, and put in a gene that encodes something that will target these cells to the cancer. But what they need to do is expand it in the lab so there's more of it, and then infuse it back into you. It's very effective, and we have had a lot of successful cases in Singapore. So this is the CAR-T concept, but it's also expanded to other types of therapies related to enhancing your immune system to fight off autoimmune diseases and allergy as well. Now, beyond cells, using your cells to fight off cancers, there are also molecules that you can use to improve or kill off cancer cells and so on. So one very well-known cancer compound is anti-PD-1. And again, if unfortunately any of you know people with cancer, like lung cancer or liver cancer, you might have heard the doctor say, I'm going to use this on your relative or your friend, anti-PD-1. Anti-PD-1 is a very well-known anti-cancer molecule that heightens the body's response to cancer. But it is not perfect. It's what we have now that we think is good, but there's a lot of side effects. So there's a lot of room for R&D to improve all these non-cellular immunotherapies. And we're in the right era to make these advances. And lastly, we look at what impacts our vaccine efficacy and immunotherapy efficacy. Our age is usually a negative factor. The more we age, the harder it is to raise an immune response. There's also the microbiome, which also impacts our immunity. And what is the microbiome? It is just the collective microbes that are living in or on you. The most well-studied microbiome is the gut microbiome. All the bacteria in your gut influences many aspects of your physiology, even your mood, how alert you are, how fit you are, can be influenced by your microbiome, all right? But in the context of this topic, the microbiome can also impact your immune response. So during the COVID-19 pandemic, your microbiome also impacts how well you take up the vaccine, how effective the vaccine is. It's also influenced by your gut, okay? So there's a lot of evidence to support that. And aging, as you know, there's biological aging, like all of us are aging all the time, but there's also immunosenescence. Our immune system is also aging, okay? And as we grow older, again, harder to raise an immune response. So you know that for the elderly, for COVID cases, we need them to really take their vaccines or take more vaccines and boosters to heighten the immune response. So we need to study the interactions between the microbiome, aging and immunity, and to see how they impact the outcome of vaccinations, okay? And knowing this will also give us ideas on how to overcome this problem. So I'm going to the last pillar before I talk a bit about the master's course, because when we talk about disease, we need to always consider, is there chemotherapy options? Are there drug options, right? And these are just all the steps that you'll find in any textbook in the identification of a drug. So I won't go into this, but it involves, of course, identifying the target all the way to getting approval from governments. But what is drug discovery? Simply, it's the process by which new medicines are identified. This goes on all the time. It's big money for companies, but it saves many lives. It's not as simple as finding a drug and applying it. There are many aspects or disciplines involved. It's a multidisciplinary venture. It involves biochemistry all the way to cell biology and physiology. Here's a busy slide, but just to tell you that whenever a drug is introduced by a big pharma, it changes our health system. It could be an anti-cancer drug. It could be something as simple as treating an infection, an antibiotic, and so on. It can change the course of our lives, also the course of history in some ways. Of course, it makes a lot of money for the pharma companies, right? In the context of COVID-19, don't worry about this busy slide, but just to tell you there are two arms to your COVID-19 progression, the viral arm and the host arm. The viral arm is when the virus impacts you, and the host arm is when you respond to the virus. There are drugs for both arms, right? So a lot of drugs were rolled out very quickly to treat COVID-19. How many of you took a COVID-19 drug? Anyone? No, right? You took vaccines, right? The drug is reserved for the very old. So this is a young crowd. Okay, so those very vulnerable would take vaccines plus the drug, right? There's a drug for the virus. There's also a drug to dampen the immune response that comes after the infection. All right? So this is just to tell you that 1 year to approve the vaccine, we also took a very quick time to approve drugs, but partly because some of these drugs were used for other indications. We pivoted the indication from flu to COVID-19, from HPV to COVID-19. Okay, so this is what we call repurposing drugs. But in any drug discovery process, there are two valleys of death. Valley of death 1 is the R&D itself. How to quickly make sure that this is a good vaccine, how to make sure that there's enough safety and efficacy. The valley of death 2 is societal's acceptance of these vaccines. How do you deploy the vaccines? Are the vaccines, do they degrade at room temperature? Do you need a cold chain? So there are two valleys of death. But what the pandemic has taught us, this can be overcome, right? With a lot of collaboration and support. So there are all these issues which I mentioned, but there's emerging partnerships and, interestingly, crowdsourcing. That means the data I produce, I share with others. We source from around the world. People are not blocking information, but sharing. And this leads to faster approval and rapid delivery. So as we prepare for the next pandemic, I just want to summarize these slides because our time is running out. We come to realize that academia is important. Universities, research institutes are very important in partnering with governments and industries, because what we find can be useful for treatments and battling diseases, right? So it's, again, crowdsourcing from the academic community. There's also importance of basic research, right, using advanced technologies, and then again working with governments. We are now adopting AI and data science to help augment our discoveries. So AI can actually predict or help you to find new cures virtually, new drugs virtually that you can then deploy or test out in reality. Okay, so we need to integrate, again, these technologies. We need to find newer drugs. But one problem is that we're all different. Some drugs work for others and not for some, right? So we need to consider patient heterogeneity. And sometimes we decentralize the trials, like, again, sourcing for information. We do many, many small trials and collate the information. But this, as a problem, when you do small trials all over, you have problems with data reliability and consistency. So to conclude this arm, what we learned from the pandemic is that there should be better integration of different agencies. We need to collaborate better between universities and government bodies. Some of the COVID drugs were found from universities, discovered in universities, and deployed in community. Global cooperation is important. Open science is important. This is a new concept where we share our data, share it throughout the world. And can we then also simulate, predict a disease by creating a fake one, virtually create a pathogen that is going to devastate the world, and then simulate how we address it. Okay, so we're in that era where we can do that. So let me end off with a course that addresses all three arms of a pandemic preparedness program, but applicable to almost any disease. It's called the Masters in Applied Biomedicine. It's conceived at the Yong Loo Lin School of Medicine, and it's aimed to provide broad-based knowledge within the field of biomedicine with focus on methods and applications in applied research. So graduates from this master's program will have the necessary research and academic skills to prepare them not just for a career in the industry, but to be leaders, because there's a leadership module as well. So you are moving to middle management or senior management. It's something like an executive course in biomedicine. Okay? This is for my Chinese audience, written by my co-program director who's from China. Okay? So the target audience, very broad. We welcome international students, but we also welcome our local working professionals who want to pivot to healthcare or want to upgrade if you're already in the healthcare industry. Because everything we teach, almost everything we teach, is going to be new. It's current and somewhat predictive of the future. Okay? This is our course committee. So that's myself, Prof. Chang, who's my co-director. We have Dr. Chris Sham, who's an eminent microbiologist taking care of the capstone project. Dr. Jeshri, Dr. Peng, and Dr. Gautam Sethi take care of the ID management, vaccinology, and drug discovery tracks. And then Dr. Petzel is an entrepreneur. He takes care of the enterprise track. So there's also an enterprise component to this package. Like most NUS master's programs, it's 1 year full-time, 2 years part-time, with 3 specializations available. If you're more into immunotherapy and cancer therapy and vaccines, then there's this track. If you're looking at how to manage pandemics, there's the ID track. And if you want to talk about developing drugs for diseases, there's a drug discovery and development track. The tuition fees are about the same throughout NUS, about 50K. Acceptance fee about the same, so we take acceptance fees, but there's an early offer now where if you accept now, there's a 50% discount on the acceptance fees. This will be used to defray your tuition fees. We start in January next year, so if you're keen, please join us. Singaporeans and NUS alumni have a special discount, right? So come and see us if you want to know about that discount. It's non-negotiable, it's a fixed rate. I can't give you more. Okay, but it's a good discount. This is the cost structure. This is the core that I talked about, which I didn't elaborate in my earlier slides because it's not that relevant. This has to do more with leadership. Okay, 5 minutes left, thank you. So we have advanced stats, leadership in biomedicine taught by a business school professor. We have enterprise and advanced data analytics. How do you analyze big data? So this gives you a very good training as you move into the 3 tracks. And then there's also a project, a mini project that you do with a professor in NUS medicine. Okay. Now, if you like, you want to do a track, you can choose the modules that you like, and you end up with a degree that's unspecialized, which is also fine. Masters of Biomedicine is enough of a specialty that can be applied broadly in many places. Full-time candidates normally do it in 1 year. Part-time candidates can do it in 2 years because you come after work, right? So we have online courses, we have courses at night. We can manage and help those who are pivoting in the workforce. For full-time candidates, you may be staying on campus or nearby and you come for your full-time course and do your projects as well. So this is how we kind of advise you to do your modules such that you can space out your commitments over the course of the 1 or 2 years. What can you do with this? As I elaborated, you can move up the corporate ladder. There's a leadership and executive education component, but it can help people in broad range of categories within healthcare. It could be a microbiologist, toxicologist, medtech, research scientist, or even a leader or supervisor of a healthcare group. Applications are open until end of September. Please apply if you're interested, or come and ask me and talk to me and talk to my admin manager, Gita, if you want to know more, right? You can scan the QR code if you're interested. There are links here, but we can send this out to you at a later stage. And for those who are overseas, please come to Singapore. It's a beautiful city, right? Am I right, guys? It's beautiful. Can we testify for the physical audience? So that 1,000 Chinese people will come. So we have beautiful things you can do over and above working on your course. Okay, so I appreciate your attendance. Thank you for your attention, and thank you for your time.
Thank you very much, Professor Kevin. So now let's go to the question and answer segment next. Okay, so we have our first question on screen. As mentioned earlier, if anybody would like physically who is attending, you can either scan your QR code over there and type in your questions, or you can just go to the center of the stage where the mic is available for you. So with that, let's go and answer the question.
So let me just read the question for the community. What kind of research area will students explore for the capstone project? So we recommend an area that's relevant to your track. So for example, you do the vaccinology track, you might want to explore a vaccine project. Maybe you want to study how vaccines are optimized, do an AI project on vaccines, for example. Now, when we launch this program, we also provide a list of professors and projects. And you are entitled, you can choose to whichever professor you want to work with for this mini project. We recommend that it's relevant to your track, but it doesn't have to be. It could be another track that you're interested in, even though you're working on one track. But we have many biomedical projects like screening for drugs, optimizing drugs, drugs against pathogens, drugs against cancer. We have projects on microbiomes or sequencing pathogens and so on. So it's very wide, but all to do with biomedicine. Okay, I hope that answers your question. Thank you. Yes.
Yeah, I think, wait, can I just ask like this?
Please.
Yeah, so thank you for your presentation, Professor. Really do appreciate the breakdown. So I am Vignesh. Currently I am serving. Currently I'm serving in the army, and then next year I'll be matriculating into engineering.
Sure.
For NUS. So I'm interested in pursuing this postgraduate course in the future after I finish my initial studies. And because I'm in engineering, right, I'm just wondering which pathway would be a better fit for this postgraduate course. Would it be through biomedical engineering, or would it be through chemical engineering with a focus on pharmacology?
2 points. Both are relevant. And in fact, we do accept bioengineers into this program. I would say that go with your strength and your interest. So if you think that drug discovery is something that you understand well and you can appreciate, then go to the one that does drug development. If you think that you're interested in something more broad, like coming up with nanoparticles, nanomaterials, then the other aspect, biomedical engineering, would be relevant to you. But both are suitable for this master's.
So in essence, it's not really like there is that. Sorry, let me rephrase that. Okay. Mm-hmm. In a sense, both have like a roughly equal chance of getting through the program and being successful at the end of it effectively.
Yes. So is biology heavy? So let's say for immunology, you need a bit of immunology background. So if you are already preempting that you want to do the immunology track in a few years, then maybe your final year project in engineering can have an immunology component. Because immunology and biophysics, immunology and bioengineering have strong interfaces. Right? So because you do this project, you have to read up on it. You have to understand the fundamentals of immunology. So you're actually front-loading your knowledge before you enter the course. Remember, your classmates may come from life science, right? Those from China may also come from life science, and they have a good foundation. Right? It's okay to learn, but then it's just added workload if you learn on the fly during the course. Yeah.
I mean, that is fine. Thank you, Professor.
Sure. So thanks, Vignesh. And just to follow up, one advantage you have actually is you're coming from a different discipline. So you're doing engineering and come into biomedicine. That gives you a different perspective to problems. You have an engineer's mind, right? And that's what we need as well in this domain. Yeah, thanks.
Okay, maybe we'll move to the next question, which is on the screen. Would the course be applicable for somebody with a technical corporate background?
Yes. In fact, this is perfect for you if you want to pivot. We like adult learners because they are mature, they know how to bide their time, they know where to focus and where to get information. So yes, if you're in the biomed industry, but let's say you're an administrator and you want to rise, you want to know if the scientist is smoking you or bluffing you, you want to know your facts, take this course. We will do case by case. Of course, if you have a science background, it helps, but let's say you have an econs background or a mass comm background, we will give you reading material. During the interviews, you can tell us and we can guide you. In fact, this is suited for those who want to pivot to this healthcare industry. So thank you for that question.
Okay, moving along, maybe we can have the next question.
Do you only accept students for Gen intake? Yes, so Gen intake is because it's just a technical thing, which is not great because a lot of people want to start early, start at different time of the year, like August, for example. So yes, Gen intake, but we hope to roll it out again in August next year. So we will shift to the August timing, which is actually more amenable for our international students. Okay, but Gen Intake is for this special cohort. But if you want to wait a bit more or you want to graduate, you can then look at August intakes from next year onwards. Thank you for the question.
So next question is, would a pharmaceutical background have to matriculate to explore biomedical service science?
So when you talk about matriculate, you're talking about you're now an undergraduate. Before you, do you have to, no, matriculate means you have to join, is it? You have to matriculate, to explore biomedical science. I think this is a generic question, not related to the masters. Actually, I'm not entirely sure, Farhan, what you're trying to say, but in general, if you enter any course, you have to matriculate. You cannot just come and listen and watch and don't pay the fees. I think that's what you may be alluding to. No, you have to matriculate in order to pursue this course. Okay, thank you.
Okay, maybe you can move to the next question. Will this course be suitable for practicing clinicians? Will this eventually lead to a pharma industry or direct healthcare industry related opportunities?
Resounding yes. We also accept applications from clinicians who want to explore the more biomedical domains of science. So clinicians are very good with clinical aspects, human health, and so on. But if you want to manage a pandemic, it's more than just treating patients. Remember, we look at the big integrated view, helicopter view. So yes, clinicians come and learn. You'll be very good with the human health aspect. But as we move on to policy making, big data and all that, this is where you will grow and learn. So yes, clinicians, if you want to pivot and move up in the more the corporate executive track, do come and join us for this master's.
Okay, maybe you can move to the next question. Is this course suitable for foreign doctors?
We welcome all nationalities. Okay, foreign doctors are also welcome. This is not a course for you to practice. Foreign doctors can practice back home. You come here and do a master's to broaden your scope. Maybe you want to spin out a company, you want to lead a team, you want to understand infectious diseases or drug development better. This course is also open to foreign doctors.
Next question.
Are there scholarships available for this course? Currently, no, because for locals and those NUS alumni, we give some discount, so we don't need scholarships in that sense. You can apply for your own scholarships to come. In certain countries, when they want to upgrade their staff, they apply to the company for a scholarship to do a master. So apply to your own home institutions. Often there are opportunities. Either you co-pay, you pay partially, or they fully fund it for you. NUS staff can also apply for this on some form of scholarship, right? So not directly from the course, but from your own institutions. Right, thank you. Is the capstone project based on lit review or based on lab work? It depends on the lab you're in. However, I don't recommend literature review because this you can do at home. But you can do meta-analysis. That means lit review is part of meta-analysis. You collect data, you crunch the survey data, you come up with a conclusion. That is better than lit review. And we will advise your supervisors, your professors, not to just do lit review because it's not worth it. You don't learn very much. Lit review you can do at home. Read Google lit review. So yes, we can start with lit review, but it must end up with something substantial, like a conclusion to a hypothesis or a question that you're asking. Okay, thank you. How would the capstone project be carried out? Okay, so thank you for that question. I didn't have time to elaborate during my talk. So whether you're part-time or full-time, once you come, you can already find a lab. As I mentioned, you will have a whole list of professors who will be dying to take you in because they want to also engage the community, right, and give you a mini project. So even though your capstone project should be done more at the tail end, you can already have a space in an NUS lab. So you come in, choose the projects that we have listed, discuss it with your supervisor, okay, and you can start later or you can start earlier. It's up to you. And this most often will involve three things: a question, what you addressing, execution, doing the experiment, and writing the report, the dissertation. Okay, 3 components. Ultimately, you have to learn a bit of the scientific process as part of this master's program.
Okay. I understand we don't have any more online questions. Maybe I would like to open the invitation again to the floor. So if you have any questions, you can just approach the mic in the middle of the room. So we'll probably take about 3 more questions.
Don't be shy. Please ask questions. So in NUS, we try to encourage our participants to ask questions, to engage the speaker. Tap, tap.
Hello. Yeah. Hi, Prof.
Hi.
Yeah, I'm Lester. I actually have graduated from NUS with a life science degree about 2 years ago, and currently I'm actually working in A-Star, in more of in a corporate position.
Fantastic.
Yeah. So kind of like I haven't been in lab for say about about 4 years, I would say. Yeah. So if say I was to apply for this course, is there any kind of like familiarization program to help with people who have
Yes.
not been in this lab background for
In fact, you won't be the only one, right? Anyone doing part-time, and we expect half our class to be part-timers like you. You're only 2 years off. There could be people 10 years off and wanting to upgrade themselves. So they're even more shaky when you hold the pipette, right? We will have an introduction. We will also preempt your professors that you have a lot of people pivoting and upgrading. So we will advise the labs when they supervise you to give you maybe 1 month to acclimatize to the new environment. But you'll be surprised how fast you will remember. It's like riding a bicycle. When you come back to it, it will come back to you. And because you're in A-Star, you're surrounded by that kind of environment anyway, right? And I believe A-Star may have some scholarships for this kind of courses, some upgrading scholarships. We can talk later also. There's a session, so you can ask me more. But yes, we can have you transit more smoothly into the system. Yeah. Thanks, Alistair.
Thank you so much.
Yeah.
Okay, maybe we'll take one last question before we wrap up the session.
Was it informative? Yeah. Was it new? Did that tell you new things, or you already knew these things? New information? Yeah. Because I don't want to waste your morning as well. And I almost didn't make it because of the roadblock. I was rushing here, then kena roadblock. Then all the training I learned in leadership course came in. Keep cool, park car, use digital app, Google Map. Then I went around, went by Shears Bridge and came here. And still, wow, lucky you made it on time, right? So this course has got leadership component.
Okay, I think since there's no further questions, let's wrap things up. So that concludes our session. We would like to invite everybody to share your view.